Hello, and welcome to the EWC podcast, where we shine a spotlight on the incredible stories and impactful work being done to support breast and cervical health and well-being in our communities. I'm your host, Carmel. In this series, we'll be exploring the Every Woman Counts program, a vital initiative that provides free breast and cervical cancer screening and diagnostic services to underserved individuals. We'll hear from dedicated community health workers, program staff, healthcare providers, and most importantly, the individuals whose lives have been touched by this program. In today's episode, we're excited to be joined by Rosie Maniela, one of our dedicated community health workers here at the Every Woman Counts program. But first, let's tackle a key question. What exactly is a community health worker, or promotora, and what role do they play in the Every Woman Counts program? A community health worker, or CHW, acts as a bridge between healthcare providers and the community. They're trained to improve health outcomes and access by delivering health education, promoting preventative care, and connecting people to necessary medical services. Their deep understanding of the community's cultural and social dynamics allows them to advocate for patients and support them in a way that fosters healthier communities. Studies have found that community health workers/promotoras are able to create a statistically significant increase in cancer knowledge amongst their population, and that this increase in knowledge correlates to increased screening rates post-education. Community health workers have long been used in a variety of settings to reduce healthcare disparities among all communities. In the Every Woman Counts program, community health workers are invaluable as patient advocates, educators, and mentors. All EWC community health workers are trained in breast and cervical health education, awareness, and advocacy, making them crucial in connecting underserved populations with necessary screenings and closing disparity gaps. Rosie, who has been with EWC since October 2011, is a perfect example of this dedication. Serving the unique Antelope Valley region, Rosie has been a key player in addressing significant health challenges in this area. The Antelope Valley has the highest breast cancer mortality rate in the county and concerningly low screening rates. Rosie's work is vital in this region, where 8.5% of adults are uninsured and 41.2% live below 200% of the federal poverty level. Before we dive deeper with Rosie, I want to extend a heartfelt thank you to all of our listeners. Whether you're a healthcare expert, a public health advocate, or just passionate about breast and cervical health, this podcast is for you. Let's get started. Rosie, can you tell us a bit about the role of a community health worker in the Every Woman Counts program?
Oh, wow, we do a lot. Anytime that we go out, when somebody calls and says, can you guys come out and share information and resources at a tabling event, at a resource fair, at a church, anything like that, it's always a one-on-one education. We don't just hand out pamphlets and say, here you go, thank you, bye. That's not what we do. We were taught that we need to talk to the women about what the program's about, what it offers, and also about how to detect the changes early, because that's critical in order to save lives. And so anytime that we're asked to come out, we get our flyers ready, our brochures ready, but also our little vocal cords ready, because we need to be ready to speak to a lot of people and do that one-on-one education with everybody that comes to our table. And sometimes it can be rather a quick conversation that we're trying to have.
Thank you, Rosie. And I also understand that the Every Woman Counts program also offers to host educational workshops. Can you tell us a little bit more about these?
You can do them via Zoom or in person. So if anybody wants to learn more or host a gathering, all we ask is that they gather 5 people or more, and then we'll be happy to come out and present on early detection of breast and cervical cancer, but early detection. But if they just want a specific topic, like if they just want to focus on cervical cancer early detection because it's January and that's when we, bring awareness to that. Then we will just concentrate on providing information on, the human papillomavirus and how that can turn into cervical cancer and also throat cancer and all kinds of other cancers caused by the same virus. And then if they just want to talk about breast cancer early detection, we can do that as well. And a lot of times we get a lot of phone calls during the month of October because that's when we bring awareness to breast cancer early detection. When we do our outreach at tabling, we also ask people that if they're interested in hosting like a in-person workshop or a virtual workshop and to just gather their 5 people, then we tell them how to go about it, just invite them and tell them, hey, we're going to have a coffee and pastries at my house, come on over, or I'm inviting you to breakfast and then we're going to talk about early detection. And so it's important to have that conversation so we can detect any changes early when there's still a lot of time to provide minimally invasive procedures.
What are EWC's screening recommendations for breast and cervical cancer?
So for cervical cancer, we ask that women start getting checked after the age of 21. And the reason for that, instead of starting earlier or whenever you become sexually active, is because our bodies are amazing. And since papillomavirus is a virus, our bodies fight off viruses. And so we're trying to let the body do its job and then go to the doctor like 3 years later, right? Or whenever you started. So it's important to get it checked out just in case that virus is there and we can, take matters and take care of any issues that might arise from it. And then for breast cancer early detection, we recommend that, first of all, you get to know your body for any cancer, right? So if you notice any changes, you can talk to your doctor about it. But they usually recommend with the Every Woman Counts program that you start at the age of 40, just having your doctor recommend a mammogram. So that way you can go and get that exam taken care of. And it usually detects breast changes 7 years, 7 whole years before you can feel it or see any changes. So it's really critical that we talk to our doctor about that early detection piece of getting our mammogram.
It sounds like you're given the challenging job of discussing a taboo or uncomfortable topic with the community. How do you handle the awkwardness or the resistance you encounter, and how does it affect the way people respond to you?
Sometimes people are very responsive and they want to know more. Sometimes people are like, no, I don't need that. Don't talk to me about that. Because like we said, it's a subject that's kind of a taboo. Sometimes people make jokes, right? And so, but for the most part, people are very receptive. When I tell them about it, they say, oh, that sounds really good. Let me plan one of those. Let me program one of those workshops. So that's the important thing is that people do, because that gives people the opportunity to have that small group setting. So that way they can ask those questions that they've been, wondering about and wondering if it's a myth or a fact, right? And they've never had the opportunity to ask. And that way they can ask it in a safe environment. So we always have those little agreements, whatever's said in the room stays in the room. If it's not your story, you shouldn't tell it unless you have permission from the person whose story it is. And so we have our agreements, but usually it's well received.
We've heard from other guest speakers on this podcast series that there are a lot of barriers, fears, and stigma to individuals accessing life-saving cancer screening services. From your perspective working closely with the community, what do you believe is the biggest obstacle people face when trying to get these crucial services?
For the most part, it's the barrier is usually the high cost of health insurance or the high cost of their copay. That's one of the ones that we hear the most. And also not knowing that they're supposed to be screening. So here in California, we're trying to break the barriers and also provide more education so that way people know when they're supposed to get it done, and also that there are many, many resources. And every time that you call the Every Woman Counts number, the toll-free number, they give you 3 clinics near you. And then if you ask for a female doctor, which might be a little easier for those people that are having that barrier, they will connect you with the female practitioner. Sometimes their copay is too high, right? Whatever their copay is. And so I told them that the Every Woman Counts program will help with that, to remove that barrier. Sometimes is they don't have transportation. Sometimes they say, I didn't know that this program existed, and that's why they don't do it. Sometimes they didn't have insurance. I know that now it's getting a little better because we in California are trying to cover everyone so that way they have access to care. And other things that are, I don't know, a little less out of our control as far as like the program itself, the Every Woman Counts program, is the, oh no, my husband doesn't allow me to get those, right? It's, and he's very jealous, or he doesn't want me to go and have myself checked out, And so that's something that's kind of out of our control, something that we cannot control. But we also encourage them to go ahead and do it anyway, because we tell them the importance of getting that screening done. And that way they can continue to take care of their family and be there for that spouse.
Are there lifestyle changes to lowering the risk of these cancers?
As with every health condition, especially like with cancer, we always recommend to know your family history, right? So if your mom had it, or your sisters had it, or your daughters had it, then there's an higher chance that you are at greater risk. So if we know of our risk, then we take special care to make sure that we tell our provider in case he wants to start doing the screening a little earlier. Also, healthy lifestyle, that plays a huge role in any kind of health. So getting enough sleep, getting enough movement, and getting nutritious food into your body. Green leafy vegetables and cruciferous foods are what's going to help us to maintain a healthy body. And so good healthy food, plenty of sleep, and movement. And when I say movement, it's so easy to get at least an hour, right? If you go out your door and you walk a few blocks down the street, you have to come back. So as long as you walk like 15 minutes out, 15 minutes back, you already did 30 minutes. So if you do that like early in the morning, late in the evening when you come home, then you get your hour of movement in. And then you can also have like spontaneous dance parties at your house, right? Just turn on your music loud and then just have the music move you. So movement, as long as it's movement, get your blood flowing, your heart pumping. That's very, very helpful. Get all those toxins out of your body.
I've heard that you no longer teach a specific way to do breast self-exams, but self-awareness is still very important. Can you discuss what we should be looking for and why?
As far as changes that might happen if we are experiencing breast changes, they said that we no longer practice this checking ourselves because a lot of women were living in fear, and we don't want people to live in fear. So what we are telling people is to just keep an eye on changes that might occur. So one the things that we're looking for when we're talking about breast health would be changes in the color of your breast, on the skin on your breasts, right? If there's dimpling, kind of like the skin of an orange, how it has all those nice little dimples. So that's not normal on your breasts. And then if you see retraction, either the nipple is retracting in, or also what happens is that the skin starts retracting in, kind of like a dimple, like when somebody smiles and you get that little dimple. Those don't belong on the skin of our breast or our chest. And if you start seeing discharge from your nipple, that's also not normal. And if you see an obvious lump, right? So if you see that there's a lump there, and most of those lumps are like hard lumps, kind of like a little pebble. So those are the changes that you would actually see. But we hope that you would catch things early by getting your exams, right? So that way you can detect it 7 years before you can see, feel, touch, all that stuff. Men should also keep an eye on their chests because of the fact that men also get cancer of their chest, right? It's the same exact thing as women and the same signs and symptoms that you will see. It's not as high of a number, but it still happens. So we need to be careful with that as well.
We've focused a lot on breast cancer prevention so far. Could you share your insights on what steps we should take for effective cervical cancer prevention?
Cervical cancer is a preventable cancer. So if you go to your provider to do your regular checkups, your regular female checkups, and have your pap smear on a regular basis, you're going to detect the changes before they become cancer. When the cells are starting to multiply quickly before it's cancer. So getting those tests done early.
I've heard there's a vaccine to prevent cervical cancer. Can you tell us more on who is eligible for that?
So yes, there is a new vaccine, and it's not that new. No, it's been around for quite a while, and it's a good thing too, because I personally, I don't find myself being in the front lines of any kind of new study. So this one's been around for a while, and it's been showing great results with preventing the human papillomavirus. And it's a good thing because it's become very, very popular. It's everywhere. So this vaccine is available for boys and girls because both can get the human papillomavirus, and they should be getting it from the age of 11 to 12. And then they've also started increasing the age where women who are older, and men too, they can now get the vaccine as well. And what it does, it prevents certain types of the HPV virus, because there's a lot of different strains of HPV, human papillomavirus. But it targets the main ones that have been known to cause cervical cancer. And when it comes to boys don't have a cervix, right? Because only women have cervixes. But men can get the virus in their penis, and then it can be transferred onto the anus, and it also can be transferred to mouth, tongue, throat, all of those areas, because it's very highly contagious. So any kind of skin-to-skin contact can transfer the virus. But like I said before, also, our immune system is very strong, and what the vaccine does, it just gives it a boost. It gives it the information on what to look for, what to fight. So getting our kiddos vaccinated is super important, because eventually, someday, they're going to have intercourse. So it's important for us to protect them against cancer, right? And how many times have you heard, "Ooh, I can protect my family with the vaccine from cancer"? That doesn't happen very often.
Thank you, Rosie. Now, is there a success story that you can share that exemplifies how you and the Every Woman Counts program has impacted an individual's life?
Yes. And this is why I stayed in the program, because it's longer project. I think it was like 2010, somewhere around there. There was a woman, and I fought really hard to get in this church. I was invited after talking to a lot of their members and letting them know that this is what we do. And so I gave the presentation about early detection. And I forget if it was like a month later, I saw one of the members of the church, and she said, "Rosie, come here. And I said, yeah, how you doing? It's good to see you. Like good stuff, right? And then she says, I want to thank you. He goes, because I had not gone to do my checkups in a very long time. I just didn't think it was important. I'm too busy taking care of my family and being a mom and a wife and a caretaker and a homemaker and all these other things. And he goes, I'd never gone to, to take care of myself. He goes, and they found some changes. He goes, but luckily, I was able to use the program and I'm being taken care of. It was really heartwarming, and it was good to know that we're actually saving lives. We're not the firefighters or the police officers, but we are saving lives because she has kids and, a husband and a mom that she was taking care of. So yeah, she needed to be taken care of too.
What an incredible story. Now, as we wrap up, is there anything else you'd like to share with our listeners?
Yes. So just in closing, I would like to encourage each and every one of you to invite these other 4 women or men to create your 5-person or more group and call the Every Woman Counts program and ask to schedule a workshop, right? To learn more, to get your questions answered, and to learn about early detection, because early detection is the only thing that we have. There's no preventing cancer. You remember that cancer does not discriminate. It picks on everybody. Doesn't matter who you are. And so it's good to know more. And the beauty of the program is that it's good throughout the state of California. So if you have friends or family members that live in, I don't know, Sacramento, just to say somewhere, then you can pass that number on to that person, that family member, that friend, and then they can use it in their area. And even though right now, a lot of people now have Medi-Cal and they're able to go get their checkups taken care of, you might know of somebody who might need that resource. So get your group together so that way you can encourage another woman to get their checkups, and that way they can detect changes early.
Thanks again for tuning into today's episode of the EWC podcast. And again, thank you, Rosie, for chatting with us about what it's like to be a community health worker for the Every Woman Counts program. In today's episode, we explored the vital role of EWC community health workers and how their dedication brings essential health services to our communities. Their efforts in promoting breast and cervical cancer screenings, overcoming barriers, and self-awareness play a crucial part in early detection and prevention. We've learned about the current screening recommendations for breast and cervical cancer and discussed the significance of staying proactive with health checks. We also touched on how lifestyle changes can decrease the risk of breast and cervical cancers. The EWC program offers resources like workshops and educational sessions to help individuals lower their cancer risk. These sessions focus on how small lifestyle adjustments, such as increasing physical activity by walking 10 minutes a day and reducing alcohol and smoking consumption, can significantly reduce the risk of both cancers. And lastly, Rosie shared an inspiring story of how an individual's life has been impacted thanks to the support and the resources provided by the Every Woman Counts program. Success stories similar to what Rosie shared are testaments to the program's profound impact and the positive difference it makes in people's lives. As we wrap up, we encourage you to stay informed, stay proactive about your health, and take advantage of the resources available to you, whether it's scheduling a screening, seeking support, learning more about preventative measures, or simply listening to a podcast. Every step you take can contribute to a healthier future. Thanks for tuning into the EWC podcast. If you found today's episode engaging and informative, please spread the word and share it with others who might benefit. If Rosie's role as a community health worker for the Every Woman Counts program caught your eye, we invite you to reach out and explore how you can become part of our impactful team and make a real difference in the community. To get connected with our program, reach out to the local office at 323-647-4711. Until next time, take care and stay healthy.